so big too.
I know.
Is this true? He can swallow pills?
I mean,
well, if you smother it with
jam.
jelly.
I know, but I mean, I can get 10-year-olds to do that. You must be so grown up.
His cancer drug he's on cannot be chewed or broken up, so we had to
learn. Yeah, I guess. Oh, you want to see my bag? I know. I have this bag that you can see everything in, but you can also wipe down with Lysol multiple times a day.
He goes, okay.
And say no more white coats in this place. Hey, I see. You want to see my stuff? You know what? I have one thing. You want to do your exam first, and then I heard the story from Dr. Pistacchio. I want to check it with you guys, though, because then I can let him check out one or two tools here. But there's lots of stuff in here. Oh my goodness!
Wow,
I know. I should have brought. I brought 2 hammers actually because boys always take my hammers.
Love to hit things.
All right. Do you want to sit with your mom or your dad? Where would you like to be?
You want to sit on my lap?
I'll bring them over. Don't worry. Hey, can you talk to me? How you doing?
No talking yet.
No talking? Okay.
Just noises.
Do you have it? Yeah, no. Okay, no name for the puppy?
No.
If you want to be careful with that, just don't hit hard. Yeah. Okay. So here, let me show you what I do. I put my fingers on you and then I hit me. Look at that. Okay, let's see. Okay, so it was this left side that was given the trouble before. Okay, I know this is kind of backwards order, but you know what? At this age, we're just happy to get cooperation. Hey, can I check this arm? Just relax this arm for me. Just let that one go. Boom, 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 boom. Yeah? Okay, switch hands.
This one?
Let's try this one. Boom, 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 boom. Good job. Okay. All right. Look, and then we have the frog for to check the eyes. Okay, good job. Nice pupil. Very good. Okay, you want the frog? Yeah, not interested in that anymore. Okay. No
Is that a
problem.
froggy? What does a froggy say?
Ribbit.
Ribbit.
Mm-hmm. Let me feel your muscle tone. It feels all good. And all good. Very good, actually. Okay. And now that I've checked out your legs, can I feel one of your arms too? You want to hold the frog in one hand?
Yeah, hold the frog over
Okay,
here.
I'm just going to move this arm, okay? Good job. And we switch hands? Okay, we're going to do everything. Perfect.
Yeah.
Hey, can you come, baby?
Can you do that? Can you go like this?
That's why we sometimes just use the frog, because we can see lots of, small movements. It looks like he uses his hands really evenly.
Yeah.
Does he use it left a little less sometimes?
A lot less.
Really? Okay. We're just lucky because he likes the frog.
Yeah, I'd say like 40%.
Interesting. Okay. I mean, that's kind of what you would expect, but he's got quite good hand use. Remake.
And he just broke his left foot, which complicates things.
How do you do that?
Dancing on the couch.
Dude.
So he's got like a limp, which of course it's on the left side. So
Of course, makes it easy.
Yep.
Yep.
So he's still
Okay.
funny.
While you're sitting there so calmly, let me listen to you, and then maybe we'll get up and do some jumping, huh? There we go.
I gotta cut you outside.
That sounds really good. Let's go under here. Okay. I'm just going to come back here.
It's okay.
Yeah, you're being really good.
You are.
I can't believe it, really. For someone that's been around doctors so much, I would think
I
you'd
know.
be really tired of it.
strangely
We're
doesn't
always like,
have
how is he not terrified of the hospital?
even a fear of walking in here. He's just,
No, he's good?
Yeah.
Okay. Couple
Knock on
of
wood.
things. Is this one's cold.
Ooh.
Woo! Woo! Yeah? The neurologist and me okay, you can see it. Oh, okay. Let me just see, is it cold? Is it cold on your belly? Woo! You just go up and down the spine real quick. This is a quick way to check for lots of woohoo! Yeah, you feel it all the way down. No, it's okay. Sorry. Sorry. Okay. Do you want to get up and walk around so I can watch you? you can take the frog. Do you want to walk to the door? Can you, if I move, will you walk over to the door? Or will you walk between your mom and dad?
Yeah. Over here.
All right.
Go to Papa. James. Steve.
James, can you come here?
You go to Dad.
Oh,
Go to
James.
Dad.
James,
Go get him.
come here.
Go get Dad.
Come here.
Right.
Come here. We know what this means. Come on. Come here.
I see.
Frog
Very
down.
good.
Arrgh.
And those later, so we have the Lysol wipes for. Oh, I want to see that.
He's a climber.
Uh-huh. Like most boys his age. Most likely reason for a hemorrhage in a boy your age is falling off, jumping off of something. But, okay, good job. So you look pretty good. Yeah, good work. I see though. When push comes to shove, the left arm goes down.
Yep.
Yeah.
Yeah. Okay, you're ready. All right. Well.
See you later.
Yeah. Okay. All right. Well, that's a good like initial check at least. So let's talk about things. So obviously, Dr. Pistachio and I have talked a little bit, but understand the left-sided weakness was the weekend. Let's see, not last weekend, but the weekend before MLK weekend.
Yeah,
Yes.
I think so.
It was that Monday.
Okay.
MLK Day.
Monday the 18th.
Was that
Okay.
when we were
That was
driving
when
around?
that was the day. We noticed it on Sunday, the weakness and the half smiling and the drooling.
You noticed that on Sunday.
Sunday evening, yeah.
Okay.
And then on Monday, still happening, and then we just went for a drive to do something, and he had like an uncontrollable cry fit.
Pain meltdown.
And it definitely seemed like pain.
We don't know if that's related or not, but
That's when we called.
we both noticed. We're like, that's really weird, and then we started noticing all the other symptoms like heavily.
So
we
He's
were-
a pretty chill
Yeah.
guy. I mean, when you meet, he's
For the
always
most part, yeah.
Yeah.
I mean, he used to be. He's definitely gone in spells where he'll, for a couple weeks, be like super, super fussy. That was more when he was younger and maybe like post radiation, but lately he's been okay. So when he just started like crying uncontrollably and it seemed like something hurt, we were like, okay, that's not normal.
Was he grabbing at his head or his neck or anything?
It's more so like he does the only way I can sometimes assume he's having a headache is he'll squint, like kind of just when he's crying.
Mm-hmm. Yeah, because he really doesn't have words.
He doesn't, and it's still hard to communicate with him and to know anything really.
Okay. So he won't, if you say what hurts, he won't point to the belly or the head. Okay. Okay.
You want out? You want open? Say open. Thank
Good
you.
job.
So we've got some signs.
Got some signs.
How many signs would you think?
5 maybe?
Got
Please.
please, open, help.
More.
Hungry.
Sometimes hungry.
Okay.
Sleep now.
Sleep.
We just want to sleep.
Okay.
Tired.
Normal water.
Yeah. Oh yeah, 6, that's pretty good. Yeah. Somewhere, you know.
His expressive speech is testing at like the 2 percentile. And then
There's 0.
there's like none. And then most of the other indicators, or I don't know what the proper terminology is like in the below average of the bell curve.
Okay. Okay. And just so I know, I mean, I know that the cancer came at 6 months of age and that, but previous to that, he was a full-term baby with no issues. Okay, so at 6 months he was, you know,
6
kind
months having seizures, but
Yeah.
we didn't know they were seizures.
Right.
And then.
And I know you see Dr. Reddy, one of my partners,
Yes.
but it's always like a game of telephone if you read
Yeah.
other people's descriptions. Like, what do you guys see when he has a seizure?
Well, when he was little, I mean, I have a video I can show you.
It looked like we
have one
we
on
thought he
tape.
was pooping. He would zone out and like little.
Yeah, when he was 6 months, because he was still a blob. Okay, yeah. Did you bring that then?
Yeah, I did. Let's go on.
You know, he was still.
Okay.
He was just starting to sit up, and he would like be playing in his little standing thing, and he would just kind of glaze over. Sometimes it would look like he was turning red a little bit, like maybe he's pooping. And they would last anywhere from like 10 seconds to a minute, and then the one we got on tape was about a minute and a half, and I was away for the
You like
first
that
time.
sound?
Kevin sent it to me, and when I was getting back from this trip, I was like, let's show our pediatrician when we get home, because that definitely looks weird. And then the next morning he had the big one where he passed out, and I mean, he was there, I wasn't, but he turned blue and
Heard him choking and
Yeah.
turned back, and he was unconscious, seizing.
And he had what, like a convulsion where you saw everything jerking.
Yeah.
Okay. But since
And then the one he had in October,
okay.
he had a big one in October, which we hadn't seen one since the first one when he was 6 months.
Okay.
We thought maybe we were seeing some along the way after his first surgery, but probably realized that those probably weren't seizures, just sort
Came
of
in
like
for 48-hour.
Yeah.
surveillance and nothing. But then the one he had in October was grand mal, like
20
lasted 20 minutes. We were sleeping, he checked the monitor, James was shaking, so we went to grab him and he was having a seizure, and so we had to administer the diastat, called 911, got him to the hospital, and that one was like convulsing. That was like the whole thing.
Yeah.
A really scary looking one. So,
And since October?
not that we know of.
Okay.
Yeah.
And so, nothing I've heard about this episode of left-sided weakness and drooling really sounds seizure-like.
Right.
But, just have to ask, you didn't notice like eyes beating one way or jerking, and the face, was it only face? Or
Pretty
was
much. I'll show you. I took some pictures.
Okay.
Where we would just be like, that's like a full half smile, like he's not even. And it was not all the time, but that's when I started to be like, that looks weird.
Yeah, that's pretty. Yeah.
And then he would like, if I was on this side and he would have this side of his head on me, I looked down and there was like a pool of drool, which
He's never.
he hasn't drooled since he was a baby, and so
Right.
we were sort of like, this seems off.
Strokey.
Yeah, exactly. Okay.
But yeah, no seizure since we've upped his meds. Leading up to the big seizure in October, we thought we were seeing some seizure activity, and we had flagged it with the doctors, and they were just like, I mean, unless, we just need to keep an eye on it, and then he had the big one, so
Okay.
we aren't 100% sure if it was seizure activity, but it was similar to what we were seeing before the big one in October. Was he was very conscious, but just similar to when he was little, where he would just kind of zone out for a little bit and even wince, like be like,
Maybe some chewing, like a.
Yeah.
Some weird
Okay.
chewing.
And that's very complex partial seizure like. You
Yeah.
said chewing,
Yeah.
picking,
right,
eye deviation, zoning.
yeah,
And zoning is hard. It can be.
Right.
There's so many reasons a kid can zone, like
right,
boredom, fatigue,
Right.
whatever. But if
Right.
it comes with the others, like if they
Yeah.
run together,
Yeah.
right.
that's when you sort of.
And then the big one happens. We were like, okay, maybe that.
Yeah,
we
and
were
then you're
right.
like, and he
So-
takes that kind of uneven split of ox carb 3 and 7 ml
Yes.
because it makes him sleepy, I guess.
Yes, he was. There was like a month where he was like not napping, super cranky, and we're still in a weird, like it's better for sure. Once we switched it, it got better. He's so pissed off when we put him to bed, usually.
Interesting.
So it's
Okay.
very weird. Like we go do the bath, and then when we're like the time in between bath and him getting in the chair with me to read a book, which he won't even really let me read anymore because he's just so zonked by the time. And we put him to bed at 6:30. So we moved it up 30 minutes because we were like, he's clearly tired.
He's exhausted, yeah.
And he's not napping as much as he used to. And he's on this medication that's supposed to, not only the triliptal, but
Cancer.
the cancer drug is supposed to, bring a lot of fatigues too. So we're,
Fights through it.
Yeah, of course, because he's,
yeah.
a 2.5-year-old boy. Yeah. Okay. So, so just to be clear, then you saw, the sort of Sunday night drooling and drooping a little,
Yeah.
and then more convinced of it Monday.
Yeah.
anything else, but I mean, he always has just a little bit of weakness on the left
Right.
side, but not more than you had seen. I mean, you didn't feel like that was intensified or anything.
I mean, it's hard to say because of his ankle
Broken foot,
too.
he's been-
Yeah.
And in my head too, I'm like, and this could be, we'll never know, but I'm like, did he hurt his ankle because he was weak on the left side, and that's why it, he hurt it while he was dancing on the couch. I
Right.
don't know.
Right.
I did not notice how little or how much there was a difference between left and right hand until physical therapy last week. We were here and
Mhm.
they were forcing him to do things with his left hand and he just wasn't doing it as well.
Okay.
So
So maybe
Yeah.
it's a maybe. Okay. I mean, but nothing really hits us as like sudden onset, bam.
No.
Like he didn't, like scream, grab the back of his head,
No.
and seemed off or
No.
something like that. Yeah. Okay. And the reason, I'm pushing on these details is, you have a neurologist and a good oncologist. I'm a vascular neurologist. I did an adult stroke fellowship after my residency training where Dr. Reddy did epilepsy. And so we see kids who have, aneurysms and other vascular causes. The aneurysm is not the most common cause of a bleed in a kid, but they're, and there are, Dr. Kostaki and I share several kids who had proton beam radiation that have vascular issues. And, of course, everyone when you ask says, oh no, it doesn't do, shouldn't do that. Like,
Right.
well, we have 4.
Yeah.
I think maybe we don't have that much experience with it, but it can, right? And so, that is just, we're just thinking, and I can show you, sometimes a picture is worth 1,000 words.
Yes.
So this is his MRI, right? And this is like,
This is the most recent one.
most recent ones. This is like him laying in the scanner, and this is his left side with an L, right side. So imagine his head here and his feet coming out at you. It's
Got
like
it.
flipped.
Got
You know
it.
what I mean?
Got
So
it.
this is his right side, even though it's on the left of the
Got
screen.
it.
And that's the tumor bed. And then there's this dark, this is blood, and it is sort of this weird, hazy, it almost has a circle there,
Yeah.
but then has this sort of like, kind of tracks along where the tumor is. And, it is, I don't have the markers on here, but, that's probably somewhere around 1 centimeter, so this is a few millimeters. And it's a weird pattern. I see kids with a lot of vascular lesions, and that doesn't really fit most of the vascular causes, which I guess makes sense. And then we also look on these kind of images. This is what's called a T2, right? So then you can see this is where his tumor was. This is a fluid-filled space. And a lot of times, if you have a vascular abnormality, you'll see it'll show up like a hole. See, I don't know if you can see there, but like, oh, come on, like that's an artery right there. Like that's the flow void for where an artery ought to be. Sometimes you'll look on here and you'll just see like this like kind of gaping hole in there, and you'll be like, oh, there's an abnormal blood vessel in there. Well, I don't see it, right? And then they did a blood vessel study, which looks like this. This is the reconstruction of your carotid and middle cerebral artery and carotid. So this is the side we would look at. And this sort of picture does a really good job at large vessels, right? So these are like the big arteries in the brain. And then you can see these medium vessels, a little sized vessels a little bit. Small vessels you really can't see. It's just below the resolution of this technique. We love these because there's no radiation involved,
Right.
and no dye. It has to be given to give that. It creates that from all these slabs. They basically they change the magnet to make it pay attention to where vessels are, and then they stack all these pictures up. And so sometimes if you look on here, you can look really carefully at this blood vessel and see, are there any weird branches coming off? Is there anything, funky happening there? Something kind of coming in that looks like a vessel. And there's like a couple little wispy things here, right? But nothing that clearly says this is what caused this whole area of bleeding. There are vessels near there. And again, sometimes giving radiation or having surgery, there's just a weakening of the wall of a vessel, right? That then will cause some bleeding. And if it's big, like if you have a traditional, like an aneurysm rupture, people classically say that's the worst headache of your life. People grab their head, all of a sudden, scream, and then sometimes they're unconscious, or sometimes they're just like, what just happened to me, And so we don't get any history of that kind of high pressure, high volume bleed. The history sounds like, either slow bleeding or, I suppose you could always say that something happened while he was sleeping or something, and so he didn't really feel it.
Right.
Because I guess when you think about, well, what can cause bleeding like that, right? I mean, tumor recurrence can cause bleeding like that. But, the radiologists, fortunately, at least right now, do not see that.
Right.
Having a problem with your blood platelets or clotting system can cause that. They checked his. It looks okay. Some of the the cancer drugs in the class that he's on can cause bleeding, but both Dr. Pistacchi and I looked like that one is not. That's why he didn't use Avastin, which is the classic drug that causes bleeding. And then can there be a blood vessel problem, that's like below the resolution here? The good and bad news is that if it is a blood vessel problem that's below the resolution here, it's probably not a treatable thing. When people have a big aneurysm, even in little kids, they can go up there and get it. Surgeons can get them too, but there's less invasive ways to get a lot of them, with coils or coils and glue. So I don't see that. I think, in an abundance of caution, I would probably do another blood vessel study in a month, just to be sure, right? Okay. And there is a higher resolution.
Is that the angiogram?
I would probably do a CT angiogram because so there's 3 levels of blood vessel imaging in my view. There's a few more, but like the main levels are this, which is an MRA, non-invasive, no radiation, really good pictures and lets you get an MRI at the same time. So it's almost always the first choice, as long as you're going to do anesthesia, And then second line, although better resolution picture, is a CT angiogram, which is takes about 5 minutes. So kids are put to sleep, but barely.
Yeah.
The anesthesiologist just kind of like puts like a little mask on them and waves over them and goes, okay, we're done.
Right.
They need an IV for it and stuff like that. And yes, it involves a little bit of radiation, but I'm talking sort of the amount of radiation it would take to like fly from here to California at altitude. It's not a big dose. And we have pediatric protocols, but it is because there's dye injected, it's a little bit more high res, and just the CT takes more exacting pictures. Chances are that will be normal still, and we will not see an abnormality. The third and sort of gold standard but most invasive is a conventional cerebral angiogram or digital subtraction angiogram, where a doctor punctures the femoral artery and feeds a catheter up to your neck and then shoots pictures in each area, right? So it's like someone who has a cardiac cath, only it's a head cath. That lets you see the smallest vessels. But if you don't have a clue on this one or the CT angiogram that there's something wrong, most kids never need that.
Yeah.
And the guy that we have here who does that for kids is really good. In fact, there's a tumor protocol now if you have retinoblastoma that he feeds the catheter up to the ophthalmic artery in baby. Wow. Like he takes these little, and he gets the catheter all the way up into the small vessel and shoots chemo in there. So, he does that every week. He's very experienced and he can do it safely. It's just, should you put a kid through that? There's, from many medical procedures that there's a theoretical risk with every procedure you do. And, having a catheter all the way up there isn't, it's not no risk. And so, whereas the others really are, unless you have a weird dye reaction or something. So, I would say that if we look again in a month and we don't see a vascular cause, that we let it be, and hopefully he won't do this again. If he does it again, then I think we would look at the pattern of bleeding, and if it doesn't look like a tumor recurrence, then I think you should have an angiogram. But I hope that will not be the case. I mean, kids do weird stuff like this sometimes.
Yeah.
I mean, and again, the pattern of bleeding is not a worrisome pattern.
Okay.
I mean, it really could just be that there are some leaky vessels around that tumor bed, and for whatever reason, they just oozed a little bit. Because that's kind of the way the history sounds. It doesn't sound like it was a sudden catastrophic event.
Right.
You just kind of gradually noticed it.
Right.
Yep. And
it was definitely something we just were flagging because we were like, it's definitely weird. He doesn't seem.
We had labs the next day or 2 days later. So
Yeah.
That was a lot of information.
I know it is.
So, can you explain, like, I'm a 5-year-old and take us back
Yep.
to, like...
Yep. So let's take it back to the 3 possible causes. You want to do that way?
Or just, like, 3 possible causes, kind of damage. Like, is this like an if-then? Like, if it happened once, is it more likely to happen again?
Yeah. Okay. Absolutely. So just, again, 3 possible causes: tumor, coagulation issue, which we didn't find, and a vascular kind of thing from either a slight ooze, which isn't a big deal, or a blood vessel abnormality, which we don't see, right? And then, is it going to happen again?
I know you can't say.
I mean, it's happened once. I would hope it would not happen again, right? I mean,
and the other kids that you said that you have a couple others, have they had multiple?
They have not. But it's with proton, it's more commonly been, honestly, a large artery narrowing. Like, how, you've probably heard of radiation, maybe you haven't, but radiation, the classic form of radiation, can cause blood vessels to narrow and cause strokes and problems. And the worst case is usually when that, like, kind of, how those branches were, like the center of that group of blood vessels is kind of right around your pituitary. Mm-hmm. And so people that have pituitary tumors and get radiation in that spot, you've just dosed all those blood vessels. And so they have that. And so for sure, we do see people with progressive narrowing of blood vessels. I don't see, bless you, any narrowing of blood vessel here. Okay. So I'm feeling like this is a good prognosis situation. I know we all want to be glass half full, but I would tell you if I thought, those blood vessels look healthy, what I can see of them. So it's really in an abundance of caution that I'm saying I'd look again in a month because, we try to look for things that are treatable before there's a big problem, right? And if there is something that's below the resolution of MRA and somehow it's going to progress, I'd like to find it before something blows apart, so to speak, and you have some sort of catastrophic thing happen. I think that's unlikely to happen for kind of the reasons that the blood vessels really do look healthy. And most of the time when there's a radiation problem, you look at the vessels and they sort of they just don't have a clean look to them. Mm-hmm. You just have this feeling like the radiologist will say it's normal and you'll look and you'll be like,
You think they look okay?
I think they look good, and it was a good quality study. I mean, it was a really, high resolution, clean study, and his blood vessels look healthy. So I'm hoping, that maybe, where there's been a tumor and someone has cut in there, you'd like to think everything scars down and just is gone, but every once in a while, there's just blood vessels close to the surface that as a kid grows and changes, they can ooze a little bit. Sort of, if you'd injured something on the surface of your skin, just every once in a while, it doesn't just scar down right, but you'll sort of look on the surface and there's all these little blood vessels there, and they ooze. Sort of like nosebleeds, You've not seen any of that, right?
No.
Though you've not seen, I didn't see anything on his skin, no nosebleeds or no oozing, so all that's, so not systemic anyway.
So, if we do this further testing in a month, what is it? I know you said it's unlikely, but what would happen if there was something found?
If there was something found, I would call the guy that does angiograms. His name's Mike Froehler, and I'd call Dr. Froehler and say, "Hey, I don't like the look of this," and he'd say, "Okay, have him come see me in clinic, and we'll get an angiogram set up," and
And this is different than the angiogram you just had.
This is a
this
puncture
is
the
got
groin,
it.
conventional angiogram.
Got it.
We have like a conference where we, just like they have tumor board,
Right.
we have a neurovascular conference where I look at everything, and I'll show his images there too, just for additional, anyone who has any additional bright ideas. And if there is something, I think our next conference, this is the last, so we're usually first and third, so it'll be the first week of February that we would do that. And if there's any bright ideas anybody has that they want to add anything on, we'll have time to do it before the scan.
The angiogram is not a treatment though; it's further testing, right?
So an angiogram is a blood vessel study, and it looks at the blood vessels. If there is something, so when you find something on an MRA or a CTA, right? So using an MR or a CT to look at blood vessels, there you're just saying it's there. Angio, if you go up, conventional angiography, if you go up through the groin and you've punctured, you can treat things through that sometimes. Like I want to be clear, I don't think you're going to find an aneurysm, but if you found an aneurysm, they can treat it there. Sometimes they will or they won't, depending
through
on
the
how,
angiogram.
through the angiogram.
Got
Often they can do a treatment. It
Got
depends on how it's located and stuff
Right.
like that. Whether it would be better for a surgeon to do it or
Right.
interventional. They're interventional neurologists, neurosurgeons, whether they would do. But again, I don't think we're going to be in that space. I guess I just want to be very clear that I suspect we will say we're not really sure why this happened, but it hasn't happened again, which isn't satisfying, but is better than finding something.
In the grand scheme of things, this seems like I'm concerned 4 out of 10. It's not.
Yes, that's right.
It's serious, but
and the reason
of now, it's kind of okay.
Right, and the reason I'm not more worried is just because the way the MRI looks.
Okay.
It looks okay, and the pattern of the bleeding doesn't look worrisome for a vascular issue. But again, whenever you've had proton, we know that proton does weird things to blood vessels sometimes.
And it's right on the wall of that tumor bed.
That's right.
Where a lot of energy would have been, and
where there would have been a lot of
cutting.
energy, and there would have been a cut there, and all those sort of things. And so, I'm not sure that I, as a neurologist, Dr. Pistacchi may have other thoughts about radiation, but that I totally understand all the late effects of radiation.
Yeah.
I know that I see a subset.
Yeah.
And so, is there? Would you expect there to be a issue? And we talked a little bit. I talked a little bit about that yesterday, and he was like, every time I ask people if they see these issues with proton, I ask people at MD Anderson, I ask people, and they always say, "Oh no, not really." And he's like, "Why do I see them?" But I think it's just such a small number.
Right.
So, okay. So.
No bungee jumping, probably.
Right. No bungees.
Other than that.
And I would not restrict him. He's got a great, he looks great.
Yeah.
And he hasn't really smiled at me, but I kind of think his face has gone back to.
Yeah, we've definitely
It's better.
noticed less of the half smiling. It seems much better.
And that's the case. Most kids will have, improvement over a few weeks to months where things kind of go back to the way they were. Occasionally when kids are tired, you may see kind of re-expression. You may see him weaker on the left when he's tired too, right? So when your brain is tired, it kind of reverts back to the lowest common denominator. So I don't think I would, if you saw a little bit before going to bed one night, go, "Oh my gosh, we gotta go." Instead, sort of, I would just keep an eye on
so that if we see X, well, what should we be looking for to be concerned again?
So, to me, concerning features would be vomiting. So people that are, people that have a big hemorrhage, right, are usually suddenly they look sick, they just look a little bit scared. I've seen a lot of kids with brain hemorrhages. They look a little bit scared, sick, and then they often are weaker on one side, and almost always will start throwing up and just be out of it.
Okay.
And
Is this an
that's-
immediate 911 situation?
Yeah. I mean, if you see that, if you see like out of it, vomiting, not alert, yes, don't drive him in. I mean, I know you live close,
Right.
but there's stuff people
Yeah.
can do
Right.
to help him
Okay.
if
Sorry.
needed. But hopefully that will never happen.
Just
I know.
covering bases.
But yes, no, you're right. You should always cover
And
bases.
we've had a lot of scenarios where like probably not going to happen.
And then it happens. Of
And
course, yeah.
So we're
Yes,
like,
that's-
we are the type of parents that want to plan for worst case scenario because we have had to deal with.
You've had the worst
that.
case scenario
Yeah.
many times.
Yeah.
Yes, and I
Okay.
totally get that. So, let me just talk to Dr. Pistachio. I don't think he'll mind if I order tests every
Yeah.
once in a while. He's kind of like,
We're seeing him right after this too.
yeah, I know. I'll just text him. You know,
Okay.
we trained together in Baltimore
That's what he said.
years ago. So I don't
He was
know.
adamant we came down here.
Yeah.
Just to you.
Well, I mean, you know, I think everyone, and I'd probably be adamant if
Yeah.
someone had a brain tumor that they see him. I think it's
We love him.
it's-
great.
yeah. I
We
mean,
love him.
so.
You want to get in your chair?
But you look great. Thanks for coming to see me. Maybe you now won't be afraid.